Hey guys, this topic is the further details about range of motion from chapter 3, book is Therapeutic Exercises, Foundations and Techniques, 7th edition. You can see the book's cover page from the video's thumbnail. So, moving towards the video that is about the principles and procedures for applying the range of motion techniques. So, the first step is the most important step, that is examination, evaluation, and treatment planning. So the procedure includes, first of all, we have to examine and evaluate the patient's impairments and level of function, determine any precautions and their prognosis and the plan of intervention, then determine the ability of the patient to participate in range of motion activity, whether it's passive range of motion, it's active range of motion, or active assisted, to meet the immediate goals. Then we have to determine the amount of motion that can be applied safely for the condition of tissues and for the health of the individual. Then we have to decide about the range of motion techniques or the patterns that can best meet the goals. Range of motion techniques may be performed in uh, following ways, like in anatomical planes of motion, in muscles range of elongation, in combined patterns, or in functional patterns like the motions used in the activities of daily living that are called aerials. Then we have to monitor the patient's general condition and the vital signs like the warmth, the color of the segment, the range of motion, the pain, the quality of movement. Then we have to document the findings and communicate the findings and intervention. And then we have to re evaluate the whole procedure and modify the intervention if necessary. Then the most important step is patient preparation. We have to prepare the patient for a range of motion techniques. And the steps include communicate with the patient, describe the plan and method of intervention to meet the goals, free the region from clothing, from splints, for dressings, drape the patient if necessary, and position the patient in the most comfortable position and position yourself so you can perform properly the body mechanics. A physiotherapist should know about the applications of techniques, both passive and for both active range of motion. And we will discuss separately the applications of passive range of motion and the applications of active range of motion. But now we have to discuss about the applications of the techniques as a whole. So for the range of motion techniques, following applications should be took under observance, like to control the movement, grasp the extremity around the joint. If the joint is painful, modify the grip, support the areas of poor structural integrity, like as hypermobile joint in the recent fracture site or in the paralyzed limb segment. We have to support the areas of poor structural integrity. Move the segment through its complete pain-free region to the point of tissue resistance, and do not force beyond the available range. If you will force the motion, it becomes a stretching technique. It will not be a range of motion. Perform the motion smoothly and rhythmically with 5 to 10 repetitions. Next, we will discuss about the applications of passive range of motion. While performing passive range of motion, the force of movement is external, as we have discussed in the previous video, and it may be provided by the therapist or by a mechanical device. No active resistance or assistance is given by the patient's muscles, because if any assistance is given, it will not be called passive range of motion. It will be active range of motion, and the motion is carried out within the free range of motion. Then moving towards the applications of active range of motion, demonstrate the motion desired during passive range of motion, then ask the patient to perform the motion. Have your hands in position to assist or to guide the patient if needed. Provide assistance only as needed for smooth motion. If when there is weakness, assistance may be required only at the beginning or at the end of the range of motion, or when the effect of gravity has the greatest movement arm, like in the situation of torque. The motion is performed exactly within the available range of motion, and it should not be forced. So now there are Some clinical tips about range of motion techniques, like when transitioning from passive range of motion to active range of motion, vary the patient position in order to use the gravity to either assist or assist the motion, because in active range of motion we have to assist or assist. So when we are transitioning the patient from passive to active, vary the patient position so it should be easy to assist or resist the motion. Then the second point is functional activities that are anti-gravity that require assistance when the muscles are less than 3 by 5 in strength. So that was all about our topic, principle and procedures for applying range of motion techniques. We can use our videos for presentation purposes and there for further lectures from this chapter. Stay tuned to our channel and must subscribe us at YouTube. Thanks.